Nothing in this video is intended as medical advice. You must see a licensed practitioner for any evaluation, treatment, or prescription. Hi, Doriana.
Do you address the pressure in the eyeballs?
Absolutely. Absolutely. That's a fantastic question. And yeah, I wrote a story in my newsletter a few weeks ago, and some of you might have seen it, where and it was a really sweet success. And it was just this woman who her whole life was falling apart. And can you imagine the pressure when your whole life is falling apart? And especially if there's somebody that you feel kind of angry and you know, it's hard for you to let go of. And, you know, life goes that way sometimes. So that pressure, and Louise Hay would say this, that pressure goes into the eyes. And so just think, there's these tiny little passageways for the fluids to move through the eyes and then to gradually get out of the eyes and go back out through the blood system. So what if the eyes are under all this tension like this? I'm exaggerating. Okay, but what if your eyes are under all this tension? Do you see how some of those passageways might get kind of plugged up?
Yes.
And of course the eye doctor says the passageways are plugged up. But the thing is, they can unplug up so fast if you can take away the cause. So can you see where palming would help?
Okay.
Right? Okay, and what I did with this woman was I did some EFT too. She had a really sudden and very high glaucoma.
Mm-hmm.
And we're talking about glaucoma, right?
Right.
Pressure. And sometimes it's better to stay away from the medical names because they're so charged. But suddenly in 5 months, one eye had gone up to 32. And in 5 months, and her doctor told her she had lost 60% of her vision, and she really needed to have surgery right now in her left eye. Her right eye was fine. Okay, so starters, I think, and I don't meddle with people. I don't try to tell people what their trip is, but I just started getting interested. I wonder if there's going to be something about mom because of the left eye. And there was. And the cool thing was she loves her mom, but things were getting very tricky. And through the tapping, she was able to let go of what was happening, and she emerged from just this one session like just beaming love for her mom. And so she went 2 days later to the eye doctor to finalize the surgery, but she secretly knew that things were totally different. Well, her pressure had gone down to 12.
Well,
so
great.
Yeah. And the other thing was kind of funny was I told her, I want you to do, and you know, it's time for heroics, you know, when you've got something like that. And I said, I want you to do at least 6 sessions, 10 minutes at a time of palming through the day. And you know, this is just for a few days. And so she wrote me back this very excited but very cute email where she said, I did exactly what you said, and I did 15 minutes at a time, 7 times a day. Because I told her to do 6 times 10. She did 7 times 15. So, but anyway, she was thrilled with the change, and the eye doctor was amazed, and all the eye doctor could say is, I guess the medicine finally started working.
Right.
And the 60% ruined eyeball, the vision started coming back, which makes sense, right? It's like if you scratch yourself or you break your leg, you know, if you let it heal, it has a way. But if you keep intact the thing that caused it, then it's harder.
Mm-hmm.
So is that a useful starting point on?
Very useful, uh-huh.
Yeah. Okay.
And you already had cataract?
Well, cataract is again, I'll defer to Louise Hay a little bit, and that is, you know, Louise Hay would say, and you know, don't take this with a grain of salt, anybody who's been diagnosed with cataract, if this doesn't ring true, but it's more like something fun to consider if you think, oh, that's interesting. Louise Hay would say that cataract, or we'll call it cloudiness in the eye, is the future looks dark. And it's like a metaphor for what the eyes are doing. The future looks dark. Okay? So then the eyes are making that happen. The eyes are lovingly making the world a little dark so you don't have to see it as well. So the mechanics that you can think of is there's a lens in front of the eyes, and the lens flexes. It goes bigger, smaller, thinner, fatter. It's a focusing mechanism. The lens of the eye. It's astonishing what it does. It does all these things and it stays clear. Well, what would happen if, see, there's a muscle around that lens too. What would happen, do you think, if that muscle, the circular muscle around the lens, just got, and it just couldn't let go. What? And it's got all these tiny little connections that are all subtle. Well, what would happen if you had this beautiful symmetrical lens that's transparent, and then you went, and I pretend this is the lens so I can kind of, okay, and then now you're going like this with the muscle. Do you see how that begins to defeat this beautiful symmetry?
Mm-hmm.
Yeah. So where I usually take people, I do a lot of visualization with something like cataract or cloudiness. And early on we'll substitute the word cloudiness because cataract is so loaded and it's so scary and it's so powerful. And the other thing I want to say about cataract is that cloudiness is that, if somebody has a lens they can hardly see out of, and the doctor changes it, I mean, life is short, and one of the things that doctors have a really, really, really good track record on is cataract surgery. And once something's really far along, maybe the right person, if they could make the right emotional changes and diet changes and all that, could reverse it. But, wow, at some point, why not cut some slack for oneself and say, okay, I don't have to do everything perfectly. Especially if somebody's like 80 years old, and they get the gift of having their sight, just like that. So I've definitely seen people come back from cataract. And another thing, I'm kind of wandering here, and then I think we'll need to wrap up. But this is very interesting. One thing I feel that I've learned is that when you have a surgery, whether it be an eye surgery or a knee replacement or hip replacement, or, I really believe that the cells, it's really worth giving them a lot of love ahead of time and give them a lot of visualization or hypnosis or whatever you want to do, and tell them what's going to happen, tell them they're safe, tell them you love them, tell the lenses that are, that you're about to like throw away, tell them, wow, thank you, I love you, and then the same thing for other parts of the body. Because I think the cells, what happens is they're in the surgery and they're going, whoa, what's going on? And then they have this energetic lingering, which could last for years. I first recognized this. My mom had a knee replacement, and she kept saying over and over again, it just doesn't feel right down there. It just doesn't feel right. And and so I was always trying to, lure her along. Well, finally, I think she was in her late 70s, and finally we went up this trail that it was an old family favorite near Phoenix, and we went up this trail, and everything got quiet. I'm hoping that I'm still on. Okay.
Yeah.
Oh, okay, great. And we go up this trail, and then pretty soon we get to this place where there's rocks, like, really has to do some stepping, and she wanted me to pull her up and everything. So I did, and so we got all the way up there, and when she was done with that, from that day on, this had been a year since her surgery. From that day on, she said, my knee feels really good. So you see what happened? It's like she befriended her new knee in that hike. So I did wander a little bit, but but I think it's relevant to the heart of this whole vision stuff. Is there's a lot of faith involved. There's a lot of love involved. There's a lot of letting go involved. And if we just, pump it up and go, I'm going to do 50 push-ups, it won't work. It just won't work. It's just more strain. So, okay. So, awesome question. And, and I digressed with it a bit, but the glaucoma and cataract and all that. So, still there?
Yes,
Okay. And forgive me, but was I talking to Doriana?
Yes,
Yeah, okay. So, so I really should wrap up since, and geez, a lot of people are here. I thank you for lingering and hanging out while I figured out how things worked. And I just want to mention again, I might have to go and tweak the website, but if anybody happens to want the Reclaim program for 20% off, that'll be a few more days with just the code of Thanksgiving. We extended that. And let me know right away if you have any questions about the Phoenix training. That's coming right up in January. And also let me know if you have other questions. I always appreciate hearing from people, and we have a support page, and you can write me through there on our website. So I'm wondering what I forgot. This started out really strange, this webinar, with all the tech problems. So, but we'll do another one pretty soon, and I think it'll go really well. And thanks to those of you who had questions, and especially thanks to Nathalie, who accidentally became my sidekick for the whole presentation. Thanks so much. So, okay, so I'm going to sign off, and it's nice to see some names that I recognized, and also a whole bunch that I hope I'll meet you one day. So, let's see. I'm going to get ready. Countdown. End meeting. And have a great evening. Thanks so much, and good luck with your eyesight. Okay.
Thank you, Greg.
Okay, thanks so much. Bye-bye.
See you soon. Bye-bye.
Okay.